promoting recovery, achieving wellness. Since the mid-1980s, the term mental health recovery is becoming more and more popular and is widely used amongst mental health professionals and those who live with a mental health disorder. Many people assume those who use the word recovery mean they are symptom-free, cured, or have recovered. This is also known as clinical recovery. While this may be true for some, for many, mental health recovery means improved quality of life, being able to live a full, happy life whilst learning to live with ongoing symptoms. This is often referred to as personal recovery. Personal recovery is a unique process for each individual, as in life we all have different needs, dreams, and aspirations. For me, recovery is an ongoing process with which I take small steps rather than leaps and strides in order to keep my balance. A journey, not a final destination. Being in recovery means I'm aware of my mental health and use coping techniques alongside my medication as a way of life every day in order to be able to maintain my stability and live a happy, productive life. Being in recovery does not mean that I will not have relapses. Many people who live with a mental health disorder may relapse from time to time. It does not mean that I do not have bad days, but hope, even the smallest amount of hope that I will feel better, that life can and will improve, is always there to help pick me up again when I stumble or fall. Although we all have our own definition of recovery, there are certain concepts and factors which are common to recovery. These are hope and belief. Hope lies at the foundation of recovery. Even the smallest amount of hope to be able to believe that things will get better helps. Empowerment. The belief that one can gain power and control over their life and their illness, taking personal responsibility and advocating for oneself. Medication and treatment. Some people will not need medication and may be able to use coping techniques alone in recovery. However, there are many people who need to use medication alongside their coping techniques. Medication is vital to their well-being and an important aid to recovery. Education and self-awareness. Understanding feelings and experiences. Learning how to live with a mental health illness and how it can affect the person. Being self-aware of own mental health, triggers, and early warning signs of an oncoming relapse. How to ask for help and support and to help oneself. Many people find support groups, courses, therapy, and/or self-teaching a very important tool. Self-help. Learning many coping strategies to help oneself live a happy, productive life. Reading and learning about symptoms and its treatment and gaining a good support network. Support. Support from family and friends and mental health professionals is very important. Many people find support groups very helpful. Meaningful activity. What a person does, as in terms of employment, hobby, or leisure activity, influences their confidence, esteem, social role, and values. Participating in a meaningful activity is a great way to regain and/or to maintain a positive identity, including a sense of purpose and value. So as you can see, with the right education, treatment, knowledge and care, it is possible to step into recovery. If you are struggling, please do not suffer in silence. Reach out and seek help from a loved one, friend, doctor or mental health professional.